Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. And each month, we select an article to feature as a press release with an accompanying podcast. And today's podcast article can be read in full at www.jneb.org for free for the next 3 months. And today, I'm speaking with Dr. Sarah Stotz, who is the corresponding author for the article titled Relationship Between Food Insecurity and Healthy Eating Behavior for Gestational Diabetes Risk Reduction Among American Indian and Alaska Native Adolescent and Young Adult Females, a Qualitative Exploration. I'm really glad to have you with us today, Sarah. Can you talk a little bit about yourself?
Yes, hi. Thank you so much for inviting me back. Lovely to be here and hopefully connect with some of your listeners. So I'm an assistant professor in the Department of Food Science and Human Nutrition at Colorado State University in Fort Collins, Colorado. I'm a registered dietitian, nutritionist, and certified diabetes educator. And I'm really proud that I had the privilege of working as a clinician for many years before I went back to graduate school for my doctorate and postdoc training, just to have quite a few years, almost a decade of experience working directly with patients. My doctorate training all focused on the development, implementation, and evaluation of nutrition education programs for people who experience limited income, food insecurity, and nutrition-related chronic disease. I'm a qualitative methodologist by training, and the majority of my work is in service to American Indian and Alaska Native communities.
And yes, that's right. This is a welcome back to a podcast. I think, Sarah, you were one of the first podcasts that I had done when I took this position. So thanks so much for coming back and doing such great work that makes it easy for me to choose this article. So can you give us a brief overview of the paper, including what you did, as well as the results?
Yeah, absolutely. So if I can just back up a little bit, I want to give a little bit of background on the context of the paper and maybe kind of a plug for anyone listening who's maybe a graduate student or even folks who are involved in research but not really planning to, be a principal researcher, a principal investigator. So I was super lucky that I worked as just a project director on a very large multi-site randomized control trial for 2 amazing multiple PIs back in 2015. That project was entitled Stopping GDM in Daughters and Mothers, and it was focused on preconception counseling and education support for American Indian Alaska Native adolescent females and their adult female caregivers to reduce future risk of GDM, gestational diabetes, and this was among adolescent females who were not yet pregnant. So they were trying to reduce the index case of gestational diabetes, which is quite rare and quite innovative, actually. So at the start of that study, I was just their study coordinator, and the PIs asked if I wanted to add a measure to their battery of surveys. I didn't really think much of it, but I said, sure, I'm interested in food insecurity, so why don't you throw in, the U.S. food security module. Now, fast forward many years, I decided to go back to graduate school. I finished my PhD, and I wrote my first NIH R21, and I focused on that data that they had collected kind of for me in the randomized control trial that I, again, was just the study coordinator, and that's where we come to this paper. So I first did a secondary analysis with their findings from their randomized control trial and their adolescent American Indian and Alaska Native females who were at risk for gestational diabetes. And then I added a second aim, which included qualitative inquiry, because I wanted to re-engage the priority audience to understand and help interpret the findings from my secondary analysis. So the secondary analysis is actually a separate paper that's already published. That was the aim 1. But now what we're focusing on today is one of 2 papers that came out of the qualitative aim of this study. So I just bottom line for any students listening or anyone new to research, if anyone asks you or gives you the opportunity to add a measure to their study that can kind of be your piece in the future, take that opportunity, because it serves me quite well and our team quite well. So back to this study. For this study, we had the opportunity to interview both American Indian and Alaska Native adolescent females and their adult female caregivers on the topic of gestational diabetes and food security. And we also interviewed key experts in these fields. this paper that we're talking about today is focused on the findings from the latter, where the other paper was focused on the findings or from the females' perspectives. We hadn't really planned on having two papers or even to really separate out the findings too much, but there was just some really salient themes with the experts who are featured in this paper that we're talking about today that we wanted to have a kind of featured in its own piece. So the objective of this study was really to understand the perspectives of key informant experts regarding the relationship between food insecurity and gestational diabetes risk reduction among young American Indian Alaska Native females. And so we interviewed 58 experts, and our three salient themes that came up are as follows. The first one is that diet and nutrition habits are formed through intergenerational food preferences, and those are driven by the lasting impacts of colonization as evidenced by present-day food deserts and food swamps, intergenerational poverty, and racist policies that negatively impact social drivers of health that impact these communities. This is just another reminder that policy systems environment or PSE approaches to improving nutrition are key, and addressing the upstream causes of health disparities is really the only way to get at the root of some of these nutrition related health disparities. The second theme is that young people are influenced heavily by what their peers eat and what their community food environment looks like, including outside of the home. And of course, this is no different for non-Native adolescent people. Just a reminder that interventions need to focus on relationships, the way families and friend groups relate to and engage with food. And this is especially powerful for Native people because as a people, they recognize and center relationality across people, across land, across resources, across the natural elements. And this is a real strength of Native communities. So I think capitalizing on that relationality in nutrition-focused interventions can be really powerful for these communities. And finally, the third main theme is just that the methods that we used in the original randomized control trial to understand household food insecurity and nutrition habits were likely limited, which is really no surprise because that wasn't the intent of the parent study. But it is an important call to action for folks who develop measures and validate these measures. This is really out of my area of expertise, but we hear over and over again. Even last week, I had the privilege of being in Albuquerque, New Mexico at a conference of diabetes-focused, community-based American Indian Alaska Native groups who lead produce prescription programs, and they shared that the USDA food security module really isn't working well with their communities for kind of a myriad of reasons. It's either stigmatizing, the questions sound repetitive and therefore are confusing. It doesn't translate well into some indigenous languages. It doesn't honor or the traditions of sharing food across families. And then folks may just be fearful to answer honestly for a variety of reasons, and we hear that outside of Native audiences as well. So I do know that work is being done in this area to improve those types of measures, and I'm grateful that we have groups that are working on that kind of work.
That was a great overview, and I also want to say thanks so much for providing that plug for graduate students or students who are new in the field, how quickly something like a project coordinator can then translate into some great work like the work that you're doing right now. You've got a lot of great information coming out of this study. So what's happened since the paper was written?
Yeah, so it's really exciting. So after months of planning, we actually we actualized the key next step in April of 2024. What we were able to do is we understood from the findings from this study as well as the feedback that we got from the American Indian Alaska Native women and daughters that we really need to think about holistic health. We don't want to focus so much on disease specific, especially when it comes to prevention and Native youth. And so what we did next is we pulled together a group of Indigenous female experts in the areas of Indigenous women's health, Indigenous culture, and social drivers of health. And we pulled together what we called the inaugural, if you will, Indigenous Women's Health workshop. These participants included researchers, professors, physicians, nurses, nurse practitioners, social worker, dietitians, traditional healers, epidemiologists. We had a dental expert there, all who often identified as mothers, daughters, grandmothers, aunts, sisters, and caretakers, and many of whom were Indigenous themselves. And so we met, and our objectives was to kind of create this space to elicit intentional dialogue on interdisciplinary views on Indigenous women's health, to think about, how can we de-silo some of our efforts, what next with this body of work. One of the action items from that workshop that we held in Honolulu in April of 2024 was to continue meeting quarterly, which we've done once. We met again in July, to submit proceedings from our workshop to a conference called PRIDOC, which is the Pacific Region Indigenous Doctors Congress, that's meeting in Australia in December. And just consider new ways to collaborate with this group, which that was really exciting to kind of even further engage, especially Indigenous women thinking about Indigenous women's health and what should happen or what could happen next. And then our group, a little bit more nuclear group, is working on a grant proposal right now, still specific to gestational diabetes, but thinking about kind of a holistic nutrition education approach to gestational diabetes and this will be for Indigenous women who already have gestational diabetes, and we're focused on food, nutrition, and trying to span into the postpartum period to help address things like breastfeeding, maternal mental health, beyond just point of delivery, which for gestational diabetes care very often kind of ends at the point of delivery, because of course gestational diabetes then goes away, but now the new mother or the woman who gave birth still has a lot of health implications of having had gestational diabetes, and we want to support this person longer than just day of giving birth.
Well, you've got a lot going on, and you've provided an excellent example of how you take the findings from one study, translate it into some application and some real world implications, certainly for nutrition education. So thank you for that. You had said in the beginning you're a qualitative methodologist, and you've published other qualitative papers before. Is there anything different about this project?
Yeah, so I think what's different is I had to, and I think, for people that are listening, as you kind of expand in your career and I guess move kind of up the ladder of, where you're at as far as what you do at your institution, I didn't collect my own data for the first time. I've always been the one that's collected all my own data. I think it was halfway I didn't have money to pay someone else to do it, and also halfway I just kind of had, I think, control issues of like, I know how I want this done. So this is the first time I didn't collect my own data, but instead we were really intentional about the individuals who did do the qualitative interviews and focus groups. Two of these individuals were Native women with healthcare backgrounds, a nurse and a dietitian. And then one is an expert in maternal child health, who was very open about her own lived experience with gestational diabetes. And so I am neither Native nor have I had lived experience with gestational diabetes. So I think we were just really thoughtful about who interviewed, and I think those conversations were far more rich than had I been trying to connect with the people that we interviewed. We did really robust member checking with these findings, and so we did a whole kind of presentation series with preliminary findings and went back and forth with the interviewees. I've always done kind of superficial member checking, but this was quite robust. Yeah, and the other thing I think we did too is, per the recommendation of, usually we have, when we do any qualitative study, almost everyone does some kind of a descriptive, survey just to understand, okay, who are people? Like, what are their ages? What are their positions? What is their race, ethnicity? All those things that we can describe the audience of whom we interviewed. And in this case, we wanted the person that we interviewed to to select what their area of expertise is related to this topic. And so we did it in a qualitative fashion instead of having them check a box like, oh, I'm a physician, or oh, I'm a registered dietitian, or oh, I'm an Indigenous healer, because a lot of the women that we interviewed actually first identified as an Indigenous mom, or first identified as an Indigenous woman who had GDM, even though it was an epidemiologist who, has all these letters behind her name. That was how she related most to the data, and that was kind of her positionality. So I love that, and that's why in this paper we have the word cloud is actually how we, because then everyone knows a word cloud, right? But then we could a little bit more clearly show people that identified as more than one of these roles. So, and then finally, as it happens, as we all know, in the peer review process, we get reviewer comments, some of which make our paper better, some of which, we may disagree with. I had some fabulous reviewer comments for this paper, and one of them was a reviewer that said, you really need to think about the term healthy diet and what that actually means in Native spaces. And so because of that feedback, we were able to add to this paper a little bit that we, talk about the term healthy diet, but that might mean a lot of different things to a lot of different people. And so I really appreciated the, just the robust peer review process with this paper.
Well, I am especially glad to hear that. And we do have some fabulous reviewers. I also wanted to comment on the way people identify, right? So as you said, we might think, well, this person is an epidemiologist, but that's not how they think of themselves first. And what a wonderful way to address that by leaving that as an open-ended rather than a checkbox, which is oftentimes the way things fall. So, Sarah, thanks so much for all of your insights, not just on this study, but also for our students out there, our people who are new to the research arena. I really appreciate that. Is there anything else you'd like to add?
Yeah, I think just, recognizing, of course, it's a team effort. I get to talk about it here, but I'm super proud of the work our team has done. 5 of our 9 authors on this paper are Indigenous people themselves. The authors represent a combination of some of my most valued mentors and true engagement of team science. And through all the work we've done together, some of these are my most precious friends at this point. So those not listed on the author list, of course, are the participants, the community members who donated their time and their wisdom and their lived experience to this project. And without them, of course, we wouldn't have this voice to elevate and learn from. So just grateful for the team as always, and to the participants.
Well, you've got a pretty stellar team there. Well, thank you again for joining me. I really appreciate it. And to all of our listeners, remember, you can read this article in full at www.jneb.org for free for the next 3 months.